Hi, I'm Kathy Cornell, Clinical Nurse Specialist at Hamilton Health Sciences.
And I'm Natalie Grundy, a Dietetic Assistant at Hamilton Health Sciences. Welcome to Stroke Busters.
We are going to help you navigate through strategies and lifestyle changes to help promote the best vascular health you can have and prevent a future stroke.
What is a stroke? Blood from the heart reaches the brain through large blood vessels in the neck called carotid arteries and vertebral arteries. Then it circulates through a network of blood vessels that penetrates brain tissue. There are two main types of strokes. The most common type, which accounts for 80% of all strokes, occurs when a sudden blockage develops in a blood vessel in the brain, causing brain tissue death, also known as an ischemic stroke. These ischemic strokes that starve brain tissue of blood may be due to a blood clot or from plaque, also known as atherosclerosis, which prevents blood from reaching the brain. These blockages can develop within the brain's blood vessels themselves or travel to the brain from somewhere else, like the heart or carotid vessels. The other 20% of strokes are caused by blood vessel rupture, where the vessel bursts in the brain, causing bleeding. This is a hemorrhagic stroke, and the leaked blood can cause swelling and pressure within the brain. Transient ischemic attack, or TIA, also known as a mini stroke, has symptoms similar to stroke but lasts seconds to hours without permanent brain injury. It's an early warning sign that you were at high risk of having a stroke. In fact, you are at highest risk in the first 2 days after experiencing a TIA. It's an urgent medical problem, but data shows that the majority of people do not call 911 during these events. What happens in the blood vessels in our bodies that can lead to a stroke? Arteries can become thickened and narrowed from a disease called atherosclerosis. The narrowing of blood vessels occurs from plaque buildup in the arteries over time and can stop blood cells and platelets from moving freely through the blood vessels. Atherosclerosis can lead to stroke, vascular dementia in the brain, angina, or a heart attack from plaque in the coronary arteries that supply the heart, declining kidney function, or circulation problems in the legs as well. Managing your vascular health through lifestyle changes can prevent the development and progression of atherosclerosis. Stroke and transient ischemic attacks are medical emergencies, whether symptoms are resolving or persisting. You need to seek medical help immediately and do not drive yourself to the hospital. Call 911 without delay. Neurological symptoms that may be affected with strokes and TIAs include changes in speech, including speaking words or understanding words, sudden visual changes, sudden severe headache that comes on quickly and it does not feel like your usual headaches, weakness or numbness on one side of the body, involving the arm or leg or both, drooping on one side of the face. Dizziness and unsteady gait can also be a symptom. If you have any of these symptoms, do not delay. Call 911 immediately. Why? A stroke can destroy up to 2 million brain cells per minute. Time is brain, so don't waste either one. There are medications and procedures at medical facilities that can resolve stroke symptoms under the right circumstance. So to recap, if you identify facial drooping, weakness or numbness on one side of the body, slurred, garbled, or jumbled speech, so you can't find the right words to say, call 911 right away. And early arrival at a hospital is important to improve your health outcome. This is a video fluoroscopy example of a brain artery where the artery, circled in yellow, is completely occluded by a blockage, preventing blood from reaching brain tissue. After receiving a clot-busting agent in hospital called Alteplase, the clot dissolves and circulation is restored. There is also a procedure that removes the clot using a wire passed into the artery, allowing for blood flow to return. These processes depend on timing, type of stroke, location, and blood vessel involved. Reduce your risk and take control to promote your vascular health, managing blood pressure and cholesterol levels, stop smoking, increasing your daily activity, eating healthy foods, minimizing your alcohol consumption, controlling blood sugars if you have diabetes, reducing the stress in your life, taking your prescribed medications, and managing weight are all risks that we as individuals can add to our toolbox of strategies to reduce future risk of stroke and transient ischemic attacks. Risk factors not under your control include increasing age, and this increases your risk because the blood vessels go through gradual microscopic changes as we age. Females are slightly more likely to have a stroke than males, particularly postmenopausal. Family history may carry a genetic predisposition for stroke in some individuals. Some ethnic groups have higher stroke risk in North America, such as African, Hispanic, South Asian, and Indigenous heritage. Having a previous stroke or transient ischemic attack means you are more likely than those who have never had a stroke to have another event. Taking your blood pressure at home periodically is a good idea to ensure it stays on target, especially if you have cardiovascular risk factors such as stroke or a high blood pressure diagnosis. For most people, an ideal blood pressure taken at home should be no higher than 135/85 on average. Those with kidney disease or diabetes should maintain an average blood pressure no higher than 130/80. Always speak with your healthcare provider about the best blood pressure range for your specific circumstance. If you have a planned healthcare practitioner appointment coming up, it's best to record these blood pressures over a period of time. Diagnosis or medication adjustments are best made when a blood pressure trend can be established. The Hypertension Canada website has blood pressure information and record-keeping logs that can be printed and used to make this easier. You might ask yourself, what can I do to guard against high blood pressure and these associated complications? Getting exercise every day above and beyond your everyday chores or work life is beneficial to your vascular health. Healthy eating, including less sugar, less salt, less processed foods, and enjoying lots of vegetables and fruits is part of high blood pressure management. Reducing your sodium intake reduces hypertension. 1 in 3 Canadians would reduce their blood pressure to normal if they reduce their sodium intake. Cook at home more often so you can control the amount of salt you add to your meals. Avoid excessive alcohol. No more than 2 drinks per day for women or 10 per week, and 3 drinks per day for men or 15 per week. And it's a good idea to skip days too from time to time. A standard drink is 1.5 ounces of spirits, 12 ounces of beer, or 5 ounces of wine. Quitting smoking is one of the most important changes you can make to reduce blood pressure, along with the many other health benefits that come from smoking cessation. Manage your stress, because stressors can increase blood pressure, heart rate, sugar and fat levels in the blood that increase your stroke risk. Take your medications as prescribed and don't miss doses. If you have trouble remembering to take your medications, talk to your healthcare provider, stroke team, or pharmacist for suggestions to help with compliance. To perform home blood pressure measurements, an automated blood pressure machine is best. Inside the Velcro cuff is a plastic bladder. The bladder length should be close to more than 80% of the arm's circumference, and the width equal to or greater than 40% of that same arm circumference. Most devices are sold with sizing indicators on the cuff and an adjustable Velcro strap. Emptying your bladder prior to taking your blood pressure and not drinking caffeine beverages for at least 30 minutes prior is recommended. Sit in a chair, uncross your legs, feet flat on the floor, and your back supported. Your arms should be bare and at heart level supported on a surface. The lower edge of the cuff should sit 3 centimeters above the elbow crease with the marking in the center. Relax for 5 minutes before starting the machine. Generally, if one arm has a consistently higher blood pressure than the arm with the higher reading is used going forward, unless contraindicated for a medical reason. Let your medical team know, though, if you have a consistent difference in blood pressure readings between your arms. If keeping a record for your healthcare practitioner, perform 2 readings twice a day, the morning and the evening, for 7 days to get a good trend of values. Practitioners generally need multiple readings to add or adjust blood pressure medication effectively. Smoking poses a risk for many diseases, and stroke is no exception. Smoking is addictive and doubles the risk of stroke. More than 40% of strokes happen in those who smoke, including young adults. Smoking makes red blood cells sticky, which increases the risk of clots forming, and atherosclerosis that thickens arterial walls. Smoking reduces the amount of oxygen carried in the bloodstream. It increases blood pressure, causing damage and narrowing of the endothelial lining of the artery walls. Smoking is addictive. If you quit smoking, after 1 year, your risk of heart disease is cut in half. After 5 to 15 years without smoking, your risk of a stroke is reduced to that of a non-smoker. Treatment options for smokers include nicotine replacement medications. The nicotine patch is an integral part of this therapy. It's recommended that in addition to wearing a nicotine patch, adjusted according to your smoking habits, the use of nicotine gum, lozenges, inhaler, or mist are added to help with breakthrough cravings throughout the day. 2 medications helpful in treating nicotine addiction are Zyban and Champix. Speak with your healthcare provider or stroke team to see if any of these options are right for you. There is also community support programs through Smokers Helpline, telehealth, and your local public health unit. If you haven't been able to quit in the past with previous attempts, keep trying, because research has shown that those who are committed to quit will usually be successful. Diabetes increases the risk for stroke. Diabetes develops when your body does not produce enough insulin or your body does not effectively use the insulin that it produces. Insulin is required to break down sugar for energy. Diabetes increases the risk of high blood pressure, atherosclerosis, which we already discussed, coronary artery disease, and stroke, particularly if your blood sugar levels are poorly controlled. It can result in circulation problems caused by damage to those blood vessel walls, affecting other body parts like eyes, heart, kidneys, and circulation to legs and feet. You can control these risks by monitoring your blood sugar every day, watching your carbohydrate intake, and eating balanced meals according to Diabetes Canada, staying active, and taking diabetic medication as prescribed. Visit your healthcare provider regularly for diabetes monitoring and management. The Diabetes Canada website at the bottom of the screen has a great deal of helpful information for the public. Keeping active is very important to promoting overall vascular health. It's best to spread your activities throughout the day into 10 to 30-minute increments, totaling about 150 minutes per week. Activities should be fun and enjoyable, so choose what you like, such as walking, tai chi, yoga, or a sporting activity. If you have a sedentary job where you sit a lot in front of a computer, get up and walk around every 30 minutes, or try using chair exercises at your desk. Keep in mind any physical limitations you may already have when building an activity plan, and talk to your healthcare provider for recommendations. Exercising should be above and beyond regular daily chores. Sometimes stress can be helpful and stimulate us to work harder, be creative, or ready us for action. When stress causes us to feel out of control, lasts for hours, days, or more, it can harm our well-being, causing a racing heart, where your heart works harder, increasing blood pressure, and increasing sugar and fat in the bloodstream. It can also trigger unhealthy lifestyle habits as a coping mechanism. Ways to reduce stress are to identify what triggers your stress and change those patterns. Remain active. Exercises release endorphins, which cause a feeling of well-being, along with physical benefits. Share your thoughts and feelings with friends, family, or a therapist. Take some time to do things that you enjoy and bring a sense of calm to your day. Make time to laugh with friends and family. Eat healthy food to feel better. Achieve a balance in your life with your work, activity, and rest. Medications are an important part of secondary stroke prevention when you have had a TIA or stroke. To manage high blood pressure, many people require 2 or more blood pressure medications to achieve a desirable range. Most patients receive cholesterol medication to help prevent atherosclerosis of the arteries. Most people will need an antiplatelet medication like aspirin or clopidogrel to keep the platelets in the blood from clumping. A small percentage of people will need a stronger blood thinner because of an irregular heart rhythm called atrial fibrillation, which can increase the risk of blood clot formation and subsequent strokes. Take all medications as prescribed. Use a Dosette dispenser or pharmacy-prepared blister pack to help avoid missed doses. Do not discontinue any prescription medications without talking with your healthcare provider or stroke specialist first.
Healthy eating for stroke prevention. So often in the past, nutrition has focused on weighing, measuring, grams of this or that. The focus of this talk is about how we actually eat. Simple facts that can help us reduce our risk for stroke. Did you know 80% of premature heart disease and stroke can be prevented through life habits such as healthy eating and being physically active? 80%. That's an impressive number. We can actually make a difference to our health by adjusting and planning the food we eat. Often we don't have control over events that happen to our health, but we do have control over the food we eat. Healthy eating includes vegetables, fruits, and high-fiber foods, optimizing protein intake, and decreasing the intake of salt, sugar, and processed foods. My healthy plate. Take a few minutes and look at this plate. Think about your plate at home and how does it compare? We will come back to this at the end of our discussion. Eat vegetables and fruit every day. Vegetables are not only for dinner. Add vegetables to breakfast. Peppers, onions, tomatoes, and spinach make amazing additions to omelets. Lunch, cut up some raw vegetables in batches or use leftover vegetables from the night before. Snacks, cut up raw vegetables, have them all ready to go in the fridge. And how are we going to make them even tastier? How about a little bit of hummus or dipping sauce? How do you add more fiber to your diet? High fiber in our meals and snacks increases satiety. It makes us feel full longer. When we feel full longer, we tend not to overeat. Overeating can lead to obesity, which then may lead to heart disease, diabetes, or stroke. Can we add soluble fibers such as oat bran, legumes, which can lower cholesterol and help to control blood sugars? Insoluble fibers such as whole wheat, whole grain foods can help our digestive system. Choose whole grains over white or processed grains. Whole grains have more fiber, vitamins, and minerals than refined processed grain products such as the white bread or white rice, white pasta. Examples of whole grains: brown rice, quinoa, couscous, rye bread. Whoa, I know you're saying to yourself, quinoa or couscous, but it's time to step out of our comfort zone and try new things. Mix it up a bit. When you're looking at labels for grain products, look at the whole grain or the 100% whole wheat. Fiber helps us feel full longer, and this can help you reach a healthy weight. Don't forget fruit and vegetables also offer lots of fiber, especially when we eat them with the skin on. What are protein foods? Protein foods are an important part of a healthy diet, important for brain and heart health, for building and keeping lean muscle. Eat a variety of protein-rich foods. Protein is found in both animal and plant foods. Eating smaller portions of meat and less often is part of a healthy diet. Try having a meatless Monday. Do not make meat the main event. When you ask people what they had for dinner last night, they usually say chicken, fish, not broccoli and cauliflower. Can we shift our thinking so the meat is not the main focus? Variety is the key. Not just meat, but chicken, eggs, legumes, and fish are all great sources of protein. The fattier the fish, like salmon, trout, herring, sardines, are higher in omega-3s that may lower blood pressure and triglyceride levels. Cover a quarter of the plate with meat as a side dish or on top of a salad. Plant-based protein. Choose them more often. They help to improve your cholesterol levels. Examples include legumes, kidney beans, lentils, and chickpeas, soy or tofu, nuts and seed butters. Having a meatless meal throughout the week is a great option. They're high in fiber, economical, and can improve your cholesterol level. We need to think outside the box and be willing to try new dishes, like vegetarian chili or a homemade lentil soup. The Heart and Stroke website has plenty of great recipes to try. What about eggs? I think eggs have really gotten a bad rap over the years. Eating 1 egg per day does not appear to increase the risks of stroke or heart disease. If you have diabetes, the research seems to be indicating to limit to 2 or 3 a week. This may change with new research. Eggs can be included in a healthy diet. They are economical and can be prepared in multiple of ways. But remember, an egg cooked with processed meat like bacon or sausage is different than a poached egg on a slice of whole grain toast. We want to avoid these processed meats. How can we decrease the amount of salt in our diet? A third of the population is sensitive to the sodium part of salt we eat. If some people eat foods high in salt, it may increase the blood in their arteries and lead to high blood pressure. Kate has already told us about the importance of keeping our blood pressure in good control to reduce our risk of stroke. Salt becomes a habit. We add it to our food when we're cooking or at the table before we've even tasted our food. Our taste buds have become accustomed to all the salt. Time to retrain our taste buds. Reducing the amount of salt. As you can see by the graph, the majority of the sodium in our diet comes from processed foods. By limiting processed foods and cooking more at home, using whole foods, you can lower your sodium intake. As you can see in the graph, the processed and restaurant foods is 75%. That's where we're getting the majority of our salt. Avoid processed foods. Processed foods contain excess sugar and salt. Avoid foods like frozen dinners, canned soups, canned stews, jarred and canned foods, and pop. So many processed foods have large amounts of excess sugar and salt. Did you know that foods such as salad dressing, mayonnaise, ketchup contain sugar and salt? When we make our own foods, we can control the amount of sugar and salt we are consuming. A homemade salad dressing containing olive oil, balsamic vinegar, and your favorite herb tastes delicious and also costs a lot less. The packaged frozen dinners often leave you feeling hungry, and they consume almost half of your day's sodium requirements. Avoid excess sugar. I think of sugar as being sneaky. The amount in processed foods and beverages is mind-boggling. Sugar comes in so many forms: glucose, sucrose, dextrose, and maltose. In 1 can of pop, you can have 10 teaspoons of sugar, and in one of your favorite specialty coffees, there can be up to 10 as well. There is a strong relationship with excess sugar. It is associated with heart disease, stroke, obesity, high triglycerides, cancer, and inflammation. My healthy plate. Now let's pull it all back together. Could you have your plate look more like this? Half of your plate vegetables, 2 cooked or 1 cooked in a salad, a quarter of your plate a high fiber starch like whole wheat pasta or brown rice, a quarter of the plate salmon or chicken. And how about a water with a touch of lemon or lime instead of a juice? Finish off with a piece of fresh fruit. Can we add fruits and vegetables we have never tried before, like a portobello mushroom grilled up on the barbecue, or a kale salad, or a spaghetti squash, or even try cooking our old favorites a different way, just to mix it up a bit. I like cauliflower florets tossed in olive oil, paprika, and garlic, and roasted on high temp in the oven. How can we make cooking at home a little easier? How about the idea of cooking once and eating twice? Last night I cooked a large piece of salmon for dinner, and today I'm having a piece of salmon on my salad for lunch. The best part is I didn't even have to cook today. The other idea is to cook in batches on a day when you have more time, then freezing the smaller portions to have on another day. You might even want to have a friend join in. If you are like me, I enjoy it even more the second time around. Foods should not be boring. We need flavor and interest. Takeaways. Eat whole foods cooked at home. Make most of your food choices from minimally processed foods. Spend most of your time on the perimeter of the grocery store. Most of the highly processed foods are in the middle. Make small, realistic changes that fit into your lifestyle over time and help develop lasting, healthy eating habits. I don't like to think of this as a diet, but a healthy way of eating, the way everyone should eat. Don't make all the changes at once. Pick one thing. For example, adding more vegetables. Once you're comfortable with that and you've made it part of your everyday, then move on to the next change. You want the changes to be permanent and now part of a healthy lifestyle. By incorporating these changes, you will naturally decrease the salt, decrease the sugar, and increase the fiber in your diet. Well, I hope this helps everyone to see that healthy eating isn't as difficult as we may have thought. We just need a rethink on how we eat and what we are eating. Remember, you can eat for your health.
These are all great websites available to the public with helpful and reliable information to promote your vascular health. Stroke Healthy Eating. This link will take you to a website with great nutritional information, plus other stroke resources on our Hamilton Health Patient Library. All the stroke prevention clinics within the Central South Stroke Network participated in the Stroke Busters content. We hope you found this information helpful, and thank you for joining us.